Hey, good morning. This is Brian Cornelius coming to you from the Simulation Center at Texas Wesleyan. We're going to talk about prone intubation and how you can recover a lost airway in the prone position. We're going to do a couple of different techniques, but the two I would primarily recommend are the use of a single site or a single held video laryngoscope, or the insertion of a laryngeal mask airway with placement of an endotracheal tube through that device. For the use of the video laryngoscope, we're going to be using the Glidescope Go. The nice thing about the Glidescope Go is it provides you your screen as well as the laryngoscope in one piece, so you're not having to look anywhere else. Other things you'll need as far as that goes: endotracheal tube with the proprietary Glidescope stylet. For video purposes today, I'm going to use the Glidescope Ranger just because it records for me and it makes life a little bit easier. But for actual patient care, I would recommend using the Glidescope Go so you don't have to look someplace else. So you have a patient in your prone position for surgery. For whatever reason, your airway is lost. Obviously an emergency in the operating room that needs to be recovered from pretty quickly. You can ventilate a patient in the prone position, but it's very difficult. So techniques to get that tube in place as fast as possible, as I mentioned, you can use a video laryngoscope, or you can also use a LMA and then intubate through that scope. So as far as placement, it's a little bit backwards than what we're used to. Elevate the table to put yourself in an optimum position. You may have to switch hands from what you normally do. So instead of the scope being in your right hand, you may have to put it in the left hand. And then remember, all your motions are going to be backwards. When using a fiber optic scope to replace a lost airway, the nice advantage of doing this is that you're able to place the LMA quickly and start ventilating your patient. We're using the Ambu brand scope as well as their airway, but any intubating LMA should be adequate. So you can easily place your LMA, begin ventilating your patient. And in essence, this removes part of the emergency from the patient. I'm able to ventilate the patient. In fact, if you had the availability of a boat eye swivel, you may continue to ventilate the patient while you place your device. So LMA is in place. I'm happy with my placement. The next thing I want to do is then go ahead and place an endotracheal tube through the device. I've preloaded the endotracheal tube onto my LMA. Just be inserting it. The other nice thing about using an LMA versus the Glidescope device is that your positioning is not quite as important. Slide the scope into the trachea. Scope's inside the trachea. I'm happy with my positioning, and then I just feed my tube in. One thing to be cautious of is to make sure that you do have the appropriate size endotracheal tube to fit through your LMA. An extra set of hands is also always beneficial as you're trying to pass the scopes out. And again, I may go ahead and ventilate my patient. Pretty fast process, and as I mentioned, it's a little bit easier because you don't necessarily have to have the patient in an easily accessible position.